What does low-grade dysplasia in Barrett's esophagus mean? Have you ever wondered what low-grade dysplasia in Barrett's esophagus really means? This condition can sound alarming, but let's break it down together. Barrett's esophagus occurs when the normal lining of the esophagus changes to a type that resembles the lining of the intestine. This change often happens due to long-term acid reflux from gastroesophageal reflux disease. This transformation is known as intestinal metaplasia and is considered a precancerous condition. It can increase the risk of developing esophageal cancer. Now, low-grade dysplasia refers to early abnormal cell changes within this altered lining. When we say dysplasia, we mean that the cells look abnormal under a microscope but have not yet invaded deeper tissues. This is different from invasive cancer. In low-grade dysplasia, the structure of the esophageal lining is mostly preserved. However, the cells show signs of atypia, which means they look a bit unusual. For instance, you might see irregular nuclei and increased staining, which is called hyperchromatism. These changes are subtle when compared to high-grade dysplasia, where the cells appear more abnormal and disorganized. Diagnosing low-grade dysplasia is important because it indicates a higher risk that Barrett's esophagus could progress to esophageal adenocarcinoma, a type of cancer. However, having low-grade dysplasia does not mean cancer is present yet. It serves as a warning sign that closer monitoring and sometimes treatment may be necessary to prevent progression. Diagnosing low-grade dysplasia can be tricky. Inflammation from reflux or injury can mimic these cellular changes, so it's best to have an expert review the pathology for accuracy. For those with a sensitive stomach, irritable bowel syndrome, or colitis, understanding low-grade dysplasia in Barrett's esophagus highlights the need to manage reflux and inflammation carefully. Even though irritable bowel syndrome and colitis mainly affect the intestines, chronic inflammation can make symptoms of gastroesophageal reflux disease and Barrett's esophagus more noticeable. Patients with these conditions should work closely with their healthcare providers. Monitoring symptoms, controlling acid reflux through diet, medication, and lifestyle changes is essential. Regular endoscopic surveillance is also important if diagnosed with Barrett's esophagus and low-grade dysplasia. So, in essence, low-grade dysplasia in Barrett's esophagus means there are early abnormal cell changes that increase cancer risk but are not yet cancer. It requires careful diagnosis and monitoring, especially for those with sensitive digestive systems, to maintain esophageal health.